Hello and welcome to this presentation on concussion in junior sport. My name is Ben McGuinness, a physiotherapist at Restore Function Physiotherapy with a special interest in concussion management. Recent research has highlighted the important role us as physios play in concussion management and its diagnosis. Throughout this presentation, I will cover what concussion is, the new guidelines for concussion management, specifically in children and adolescents, the signs to monitor, and our role as physios in the treatment of concussion, including the gradual increase in function and returning to school and sport. So what is a concussion? A concussion is a mild traumatic brain injury resulting in a temporary change in normal brain function. It results in short-lived symptoms and there is some impairment of neurological function that resolves spontaneously. The spontaneous nature of a concussion means that it is deemed a functional brain injury rather than a structural brain injury. There is no structural damage associated with a singular concussive episode. And if there is an abnormality found on a brain scan, it cannot be diagnosed as a concussion alone and therefore diagnosed as a more sinister brain injury. 90% of concussions occur without a loss of consciousness, and you do not need to be hit in the head for a concussion to be diagnosed. Forces from somewhere else on the body can be transferred into the head and cause a brain injury, which can be diagnosed as a concussion. 90% of concussive symptoms resolve within 4 weeks for both adults and children and adolescents, and symptoms lasting longer than 4 weeks are now deemed persistent post-concussion symptoms. 33 million children worldwide are diagnosed with a concussion, but only 16% of those are treated by a healthcare professional from age 10. 20 to 40% of children have persistent post-concussion symptoms, so those symptoms lasting longer than 4 weeks, and 20% of those children have symptoms lasting longer than 6 months. The AIS released Australian concussion guidelines for youth and community sport in 2024, and specifically for child concussion management. They quote, "While graduated return to learning and school activities and sporting activities can occur simultaneously, the athlete should not return to full contact sport until they have successfully completed a full return to school. This emphasises that the athlete must be able to tolerate full school participation prior to resuming contact sport. We will always treat younger athletes more conservatively compared to adults due to adolescent brains not having fully matured. In the rehabilitation of a child following a concussion, evidence shows the importance of having good support networks and structure to aid their recovery. The younger the child, the more we as physios rely on parental reporting of symptom behaviour to gauge their progress. Girls tend to report more symptoms at an increased severity compared to boys. On the other hand, we as physios will rely on your parent communication to ensure consistent and accurate messaging while each child undergoes the return to school and play protocol. This is really important that the messaging being conveyed is consistent so that all steps throughout the protocol are adhered to safely. Research shows the benefit of early intervention and resumption of normal activities. A study by Thomas and colleagues in 2015 showed that resumption of normal daily activities after 2 days improved their recovery compared to those who rested for 5 days. In addition, starting rehabilitation within 3 days can improve recovery by up to 50%. Matthew and colleagues in 2024 found the risk of longer symptom duration was increased by 34% for each day in delay to initial presentation. When resuming normal duties, if your child is not coping with these demands, it allows us as physios to provide an early onward referral to an appropriate doctor if it is applicable for their more complex presentation. From the Australian Concussion Guidelines for Youth and Community Sport, released by the AIS in 2024, there is now a minimum of 21 days that each individual athlete must be removed from competition play. During this 21 days, Each player will go through a graduated return to school and play protocol supervised by a physiotherapist. This 21-day stand-down period is implemented throughout all levels of sport and codes except for the elite and professional level. The difference in protocols at community level compared to the elite level is due to the readily available medical resources available for elite players. The earliest that a player is able to return from a concussion is on that 21st day following injury, in which the day the concussion occurs is day 0. It is important to note that this is a minimum only. Recovery may and can take longer depending on individual pre-existing factors and their symptom presentation. This will be guided by your treating physiotherapist. Each individual must be symptom-free for 14 days prior to the resumption of contact sport, and this may be beyond that 21-day mark. Each athlete will need to have completed a full contact training prior to be able to return to competition play. So what are some of the signs or symptoms that a player may exhibit or complain of following a concussion? Unfortunately, concussion symptoms are often non-specific, meaning they can overlap with coexisting medical conditions or other presentations. Subjective symptoms are what the player or patient will report, and this may be immediate or delayed in their onset. Presence of any one of these symptoms following a specific mechanism is enough to suspect a concussion. We implore you to please remove the player, or if these symptoms are delayed, to not seek further participation until clearance and review from a medical practitioner. Common symptoms are listed on the screen, so please take a moment to read through these now. Observable signs of concussion do not always occur, but they are what you, as a spectator, parent, or coach, may see in a player following a collision. Only just over a quarter of concussions display these signs. So just because these may not be present does not mean a concussion has not occurred. Following on from the common signs and symptoms of concussion, we as practitioners need to rule out what is known as red flag signs. Red flags are signs for more concern, as they often indicate a more sinister diagnosis is present. We will treat the patient as if a more sinister pathology is present, i.e. an injury to the neck or the head, until the neck or the head have been cleared and it has been proven that there is no injury to these locations. Presence of any of these symptoms listed on screen within the acute phase, being within 24 hours, please go to the closest emergency department to have the player assessed and reviewed to be cleared of a more sinister injury. Once a concussion has been suspected and a more sinister diagnosis ruled out, our role as physiotherapists begin to help relieve concussion symptoms to improve daily function. We will provide essential education regarding the concussion diagnosis, prognosis, including how long to rest for and when to increase both physical and mental activity. Seeking early treatment prevents longer lasting symptoms, and we recommend seeing our physiotherapy team within 3 to 5 days following injury. We will provide individualized home exercise programs to target each individual's main symptom drivers, often coming from the vestibular system, which is the inner ear, the visual system, cervical or neck region, as well as the autonomic nervous system. We will promote early physical activity in a safe heart rate zone, as we now know from recent evidence that early aerobic exercise is beneficial to early recovery. We will supervise a graduated return to school and work, including providing time restrictions as needed to promote earlier recovery. We will conduct evidence-based assessment via the SCAT or SCOT-6 for higher validity, depending on whether you're presenting inside or outside of 72 hours following your injury. And following resolution of symptoms, we will conduct a baseline test, as this can identify patients who are at higher risk for longer lasting symptoms as well as identifying any predisposing factors. And it will give us more objective data for individualized normative data for our return to play decision making. So what should you do on the day of the injury if you suspect a concussion has occurred? Please remember any one of the symptoms listed previously is enough to suspect a concussion. Please remove the player from play immediately and allow them time on their own to rest when they come off. Please allow a minimum of 10 minutes for symptoms to develop. This is due to the delayed nature of swelling and inflammation accumulating around the brain following the transmission of forces to the head. Please remember, following this time, if in doubt, sit them out. If you are in any doubt about their well-being, please do not allow the player to return to play. Not allowing them to return to play will prevent any secondary injury occurring to the head and the brain. After the game, please continue to observe the player and monitor for any red flag symptoms. If any red flag symptoms are present, please transport the player to emergency department as soon as possible for further evaluation. At night time, it is important to promote their normal sleep schedule, as sleep quality is a good predictor for their recovery duration. Quality sleep allows the brain to rest, decreasing its energy demand and enhancing its recovery. You do not need to wake the player up during the night to check on them. Please just monitor them more closely and allow them to sleep through the night. Researchers found medication to be more beneficial in the cases of prolonged symptoms rather than in acute recovery. Please try and avoid using any form of medication within the first 48 hours, as it can often mask the development of further symptoms. As previously mentioned, earlier presentation to physiotherapy has been correlated with earlier symptom recovery. Booking in with one of our team members, ideally on the Monday or Tuesday following concussion, allows us as physios to determine concussion prognosis, outline individuals' return to play timelines, and implement the graduated return to school and work protocol. Following our initial assessment, we will then be able to determine if further referral is needed for more complex cases. Physiotherapies are able to supervise each player throughout all stages of rehab, including initial return to contact training, but we still need you to visit a doctor for the medico-legal requirement of returning to full competition and full contact. At Restore Function Physiotherapy, we use specific doctors who have worked with and know concussion guidelines inside and out, including their previous work or current work with professional sporting teams. We will provide their details for clearance rather than you seeing your own GP, and this cannot be done on the day of the game. We will need you to do that beforehand. Players who are registered at the time of injury, and whether the injury occurs at training or in a game, will be eligible for an insurance claim to subsidise the cost of physiotherapy. All of these details will be explained in your initial appointment with your physio. On screen now is the best case scenario in recovery following a concussion. There is always individual variance in symptom presentation, and this protocol has not accounted for this. Individually specified treatment, advice, and management will be managed by your individual treating physiotherapist. You can see in the acute phase, in days 0 to 7 following concussion, we prescribe initial relative rest for the first 48 hours. We always monitor for those red flag symptoms, and between days 2 and 3, we want you to book in with one of our physio team for an initial assessment. We will then prescribe some light aerobic exercise and implement the graduated return to work protocol. Through the subacute stage, days 7 to 14, is when you will be able to increase your daily activities. You may be able to resume some light running and non-contact training in your sport-specific manner, and also maybe be able to resume some weight training. We will often advocate for endurance type training first, rather than maximum effort to reduce the central pressure on the brain. It is important to note that if symptoms recur during this phase, we will not be able to progress your level of activity, and you will be asked to maintain or regress your activity until symptoms go away. From days 14 onwards, as long as you are symptom-free and have got clearance from your doctor, you will be able to return to some form of contact training. We will continue to monitor your progress through this stage, and then once day 21 occurs, being 14 days symptom-free, you will be able to return to play. In your initial assessment with your physiotherapist, you'll be provided with this handout on screen to monitor the individual's recovery following a concussion. We will use this to assess your progress, and please take this handout to your return to contact appointment with your doctor so they will be able to see your progression through the concussion protocol following your injury. So as a summary, a concussion is a traumatic brain injury that is functional in nature, resulting in transient symptoms. 90% of concussions occur without a loss of consciousness. Concussion symptoms are non-specific, and as therapists, we will ensure that a more sinister pathology is cleared before pursuing rehabilitation. Physiotherapy can diagnose relevant impairments causing an individual's symptoms and provide early evidence-based care and education for best practice management. Our treatment as physiotherapists enables symptom resolution, safe return to school and sport and activity, with ongoing advice to promote faster recovery. Where appropriate, we will refer to qualified concussion-trained doctors to facilitate a safe return to full contact sport. Please remember that everyone's individual needs are different and rehabilitation will not be the same for everyone, so please adhere to the advice provided by your treating practitioner. For a full summary, please scan the QR code on screen to access essential concussion information. Here are some additional resources which are relevant to specific sporting codes and general information on concussion in youth sport. We are happy to distribute these if you are wanting further information regarding concussion in adolescents. Thank you for tuning in to this specific presentation on concussion in junior sport. We hope that you found this presentation useful.